Urological disorder is a topic that often doesn't get the attention that it deserves, but it's vital for everyone to understand it. From benign prostatic conditions like overactive bladder and BPH to more serious conditions like prostate and kidney cancers, remember that early action and awareness can make a lot of difference. Namaste and welcome everyone to another episode of Beyond the Pill where health meets conversation. I am your host Dr. Chetna, and today we will uncover everything that you need to know about urological disorders and to help you understand this better. Joining us today is Dr. N. Ragavan. He is a senior consultant urologist, a uro-oncologist, and a robotic surgeon practicing in Chennai. Hello, doctor.
Hi
Welcome.
Chaitana, how are you?
So, welcome to our show today that is Beyond the Pill, where health
Thank
meets
you. Thanks for
conversation.
having me here.
So I feel really good sitting here with you, and I feel very, I don't feel like usually when you sit with the doctors, you feel so much nervous. But then I think that you carry such a personality, very chilled personality, very friendly personality. So thank you for that. Actually, you're making me feel very comfortable.
Thanks Chaitana. I think that is a personality every doctor should carry.
Right.
Um, Doctors are primarily are human beings as you are and as other people are, and we are here to help each other, and therefore that is something that every doctor should aspire to be.
So I'm very sure that all your patients must be coming to meet you very regularly because of this
Well, thank you so
characteristic
much
of
for that.
yours.
Thanks for that.
So tell me, what is exactly a uro-oncologist?
Chaitana, see, for us to understand this word, we need to go in the time machine backwards. So, a while ago, 50, 70 years ago, cancers were largely left unattended. Patients used to die. And then, over a period of time, people realized that treatment for cancers were possible, and they started treating as well. And especially this stemmed from US, and then it spilled to the Europe and then to India as well, when we started having the first set of cancer institutes in India. But as the time went by, we realized that with an increasing knowledge of the cancers, the ability to treat, the variety of treatment options available,
Yes.
and the exploding nature of technology, what we realized is that by having a generic person treating every cancer will mean that that person will struggle to keep themselves abreast with the knowledge that is expanding like every day.
Right.
As time went by, people in the cancer field realized that that particular cancer needs a specialist on their own. It really first happened in the breast segment.
Right.
We started to see breast cancer specialists, coming out of the general cancer pool and taking care of women with breast cancer. Then it expanded to the gynae cancers. Then women with cancers started getting a specialist who are dealing with them.
That's right.
Then over a period of time, we realized that that cancers or that set of cancers need a specialist. I just jokingly tell my patients, I'm a high-end Mercedes-Benz mechanic. I'm not a ordinary mechanic.
But
I
that's
deal with
true.
only a small set of problems. So, in a uro-oncologist is primarily a human being, a medical professional who deal with uro-oncological cancers, meaning there are 5 cancers in the urinary tract: kidney, ureter, that is the tube connecting between the kidney and the bladder, the urinary bladder, the prostate, and in men, we also have penile cancer and testicular cancer.
Correct.
Women don't have that. So, this 5 cancers form the uro-oncology group, and
Okay.
I
Okay.
specialize in that.
Okay. So what motivated you to become a uro-oncologist?
I qualified myself as a general surgeon, and then subsequently I was trained in UK to do urology. But in UK, the first trainer with whom I started my work was a uro-oncologist.
Oh, so he motivated
So it
you.
just was very fascinating for me to see him operating and the complexity of the work we were doing. And therefore, from there onwards, it just so happened Sometimes people say the job seeks you or you seek the job. It was more like the jobs sought me. And over a period of my training period, I worked with 5 uro-oncologists and just I was quite inspired by them. So then it led me to choose uro-oncology as a subsection of the urology. I'm a urologist
Okay.
who specializes in the uro-oncology section.
Correct. Okay.
So there are urologists who specialize in stones. There are urologists who specializes in benign problems. So I'm a urologist who specializes in oncology.
So, in your day-to-day practice, what kind of patients do you see? I mean, what complaints do they come with to your clinic?
Um, so being a uro-oncologist, a reasonable amount of my practice is a referral practice, as in the patients have already been diagnosed with a tumor and they land up
Okay.
being referred to me. That
Okay.
is one segment. And the other segment, which I would say about 30-40% of my patients, are patients who walk in with a urological complaint. And from there, and today the technology is so good, they have a mild symptom, they read the Google, some things strikes them, and they say, "Hey, I want to go and see a uro-oncologist," and they turn up in my desk. So that's how they come. So whilst we are discussing this, when we go into each of the uro-oncology
Yes.
subsection or cancers, we will discuss the symptoms relevant to that,
Yes.
which itself will tell those patients who are coming to me.
Right. So starting with kidney,
Yeah.
kidney tumors.
Yeah.
I think, matlab, we just know that kidney tumors are common because of the kidney failure, or
No,
with a lot of people having
Chetana,
lot of.
that's not true.
Okay, yeah. So I want to know more about it.
Sure. So, as you rightly said, as I said, there are 5 important cancers as a part of the urinary tract cancers. As you rightly said, kidney is also a very important one. The majority of the patients with kidney cancers nowadays present without symptoms.
Oh,
Yes. So the general practice that we see is that patients have had some mild non-specific symptoms, like they had tummy pain. They had some gastritis. They went to the local doctor. He did an ultrasound that found a cancer, and they turn up here. That is the bulk of the tumors that we see today.
my God.
Yes. Well, in a way, good. I'll tell you why. Because for that, once again, you have to take the time machine and go backwards. So, about 20-25 years ago, the bulk of the kidney tumors presented with advanced state.
Right.
Cancers were advanced. They were big tumors. They were bleeding a lot. Patient lost weight, and all those symptoms related to advanced cancer is what they had. And because they had advanced cancer, the scans were done and that showed a cancer and they turned up. But nowadays, because of awareness, quick availability of scans, quite widespread use of the scan, and I appreciate that. I welcome that people are willing to quickly get an ultrasound scan, which is a
Yes.
non-invasive simple test to do, and that picks up early cancers very nicely. Why is this important, Chetna? An early cancer in kidney, in the vast majority, I'm talking about 98-99% of curative. You cure these patients.
Yes.
Vis-a-vis in advanced cancer, you find it difficult to cure.
That's true.
So, as a cancer surgeon, I want my patients to come in this stage.
Early
And that's
stage, yeah.
exactly what is happening. So, just to recap, bulk of the patients who come with kidney cancers in today's practice are asymptomatic. But there are patients who will present with other things, like sometimes urinary bleeding. Very, very rarely they present with pain or discomfort. But the bulk of the patients are asymptomatic, which is what, as a cancer surgeon, I want, because these are the patients who can be cured.
True.
In this context, I just wanted to say to the viewers who are seeing as well, it is a fantastic idea to have something like an annual health checkup,
Right,
which
right.
picks up many of these things as well.
So, what could be the common reasons for developing a kidney tumor?
We do not know.
Oh,
In fact, to be very honest with you, majority of the cancers we do not know why they happen. There are something which we know can be related to kidney cancers. And that is the most important thing that is related to kidney cancer is a smoking.
Yes.
Yes, smoking, like what I used to say, patients causes 50 plus cancers. Kidney is also one of them. And then very rarely there are patients who get cancers because there are some genetic problems with them, but they inevitably come in a family. You know
Okay.
that the dad had a cancer or a brother had a cancer. So you know that there is something called genetic syndromes in them. We do have tests nowadays for that, and we pick up that problem and we counsel the patient as well as the next generation and the generation before as well.
Yes.
So that is thankfully a small proportion. The bulk of the patients are standalone kidney cancers who we do not know, smoking being the only reason which is associated with the cancer.
And in which age group is this kidney cancer developed more frequently?
Originally, the published literature says about 40,
Above 40.
40 to 50.
Okay.
But what I am observing nowadays is that we are getting early cancers as well. We are seeing patients with 25s and 30s also presenting with this cancer. Whether it is just the awareness which led to the cancer or is there a genuine shift, I do not know. But all I would say is that we are not uncommon to find a 25-year-old coming with cancer as well.
Both men and women.
Both men and women. It used to be a preponderance towards men, but men and women also get it.
Now smoking has increased in women as well.
That's exactly my concern, Chetna. My concern is that the world is going in different ways. Smoking was very popular in 1970s, and then because of a lot of campaigns reduced by 2000, and from 2010 onwards the smoking has picked up back again.
Yes.
And especially in our country, Chetana, if you look at the non or western countries, smoking has come down there.
Yeah.
If you take UK and US, smoking has come down, but in India smoking has increased, especially in young people, and it's especially increased in women a lot.
Yes.
And that is genuinely concerning.
So so
Chandra, shall we take a minute to just tell people what all
please.
cancers can happen because of smoking?
Yes, please.
Yeah.
Please, yeah.
That includes cancers in the oral area, that is the head and neck, throat cancer, lung cancer, cancers of the food pipe, stomach, cancers of the large intestine, cancers of the motion passage, prostate, kidney cancer, bladder cancer, and in women, cervical cancer. It just goes on and on. So I genuinely think it's time for the younger generation not to romanticize smoking.
Exactly.
And it is also an opportunity, even if one film star is seeing this, if they can give up smoking in the screens, I think that is a wise thing to do.
Because it's just not them, they're also harming the people around them through passive smoking.
Yes, smoking harms them and everybody around them, and themselves and their pockets as well.
That's true. That's true. Okay, so this was about some
The kidney cancer.
like the superficial information about the kidney cancer. Now, next we can maybe go to prostate.
We'll touch up upon the treatment options for kidney cancer as well before we move
Okay,
to
yeah.
the prostate.
Okay.
So, a word about diagnosis of kidney cancer. So, let us assume that the patient gets a little scan with an ultrasound scan that shows a tumor in the kidney. They inevitably send the patient across to us. We do something called a CT scan because for us to map the tumor, exactly where the tumor is, and whether we can remove the tumor and preserve the kidney. So the concept today is that do our best to preserve the kidney.
Right.
Remove the tumor and preserve the kidney. That's a concept today. We call nephron sparing or partial nephrectomy. We try to spare the nephrons and we try to give the patients as much as possible two functioning kidneys if possible. So removing the whole kidney is something we reserve only for those very advanced cancers. By God's grace, such cancers are now dwindled down compared to what it was 20 years ago. And that is because of the CT scan availability. And the operation that is done for this is called partial nephrectomy. And very rarely in a very big tumor, we remove the whole kidney as well.
Okay. So, what are the advancements that science has made to preserve the kidney?
Amazing advancements, Chetana, amazing advancements. First thing we realized is that removing the tumor and preserving the kidney does not harm the patient. That's the first thing we understood. Previously, people used to think, oh, even for small tumors, remove the whole kidney,
Yeah,
the whole disease
yeah,
out there.
yeah.
We realized that removing the kidney or removing only the tumor and preserving the kidney gives the same outcome.
Wow.
So that's one thing we realized. Secondly, we have become better in removing the tumor and preserving the kidney by surgical techniques. How to do the operation, how to plan the operation. Those things have made it much better. The third thing that has really advanced is something called 3D reconstruction. So we take the CT scan, put it through a software, and prepare a model which will tell us exactly where the tumor is, where will I cut, how will I cut, how much I preserve. It gives you a full map, and then that helps you during the operation. Fourth thing that has advanced is called robotic surgery. At the
Yes.
end of the conversation, we'll have a general talk on robotic surgery.
That's okay.
But robotic surgery has really advanced in kidney cancer preserving surgery techniques, whereby we literally just now imagine you admit the patient tonight, surgery tomorrow, day after tomorrow, patient is home.
Okay, so you need not give the chemo and radiation and all
Majority
that.
patient don't need because
Don't
they
need.
are
Okay, that's
early
beautiful.
cancers
That's
and they're
beautiful. Yeah,
treated and they're cured.
yeah, yeah.
So that's a joy, isn't it?
So you can say that kidney cancer is completely curable.
In the majority. Yes. And we want to push that so that everybody who's seeing this program is aware that they don't need to panic on that and that they should do something like an annual checkup to
Yes.
make sure such a thing is picked up early and treated early.
Yes.
So that is the message we want to convey.
Okay. So what was the next one?
Prostate cancer. Oh, bladder cancer or prostate cancer.
So
Whichever you want.
after kidney cancer is which
The
tract?
the bladder and the tube that comes to the bladder both
Ureters.
ureters are all same. They are all integral
So
parts.
I'll go to bladder cancer. Okay. Okay. So moving on to bladder cancer. Now even I feel that lot of population has very less information about your bladder cancer as well. I feel most of them doesn't even know the word bladder cancer.
So, bladder cancer, the first thing we need to clarify to the viewers is that there are two bladders in the body. One is called gallbladder,
Yeah.
which is near the liver,
Yes.
and it has nothing to do with
I
urinary
was just
tract.
thinking how two bladders.
Okay. The other one is called the urinary bladder.
Okay.
So, when we say bladder cancer here, we are talking about urinary bladder. We are not
Yes.
talking about gallbladder.
Bladder. Okay.
Urinary bladder cancer, the reason why it is less aware is because it is definitely less common than the common cancer, which is the prostate cancer.
Yes.
So that is also one reason. Secondly, this cancer happens in an elderly population like 70 plus, 60 plus, 70 plus, not a 25-year plus
Okay.
cancers. So
Okay.
the majority of the patients are in their 60s.
Okay.
That's the second point. And because of these two reasons, it is not in the great scheme of things that everybody talks about it. Everybody talks a lot about prostate cancer.
Yes, that's
People talk a lot about breast cancer. People talk a lot about cervical cancer and head and neck cancers. These are the very popular cancers being talked about because they are common
right.
compared to the other cancers. But bladder cancer is very important, Chetana. I'll tell you why. In terms of morbidity, in terms of the impact it gives on the patient is far more than prostate cancer. Because if there is an advanced cancer in the bladder, patient has to have the bladder removed and so on. So it has a lot of impact.
Side effects.
Side effects are there.
Yes.
And therefore, even though it's less common, thankfully, it has a lot more impact on the patient who suffers with the problem. So it is an important cancer as
True.
well.
Yes. So what are the major signs and symptoms of bladder cancer?
There is only one and the most major symptom called hematuria. Hematuria is blood in the urine. Just urine में खून आता है, बस उतना ही है. कई लोग क्या सोचते हैं कि यूरिन में खून आता है कि जो गर्मी है, मैंने कैरेट खा लिया, बीटरूट खा लिया. Absolute nonsense. Beetroot and carrot won't cause blood in the urine. Blood in the urine means you have something going on. Be very clear.
That's serious.
4 out of 10 patients with blood in the urine have a problem.
Hmm.
2 out of the 10 will have a cancer.
Oh.
It is that important. So, another take home message for the viewers, if you find blood in the urine, please don't blame the beetroot and carrot. Please go and consult your doctor and get yourself checked out.
Yeah.
Blood in the urine is an important thing that cannot be ignored.
Some of them blames this blood thinners as well.
Blood thinners and blood in the urine means all the more reason you should check it. All the more reason.
Good, I pointed
Yes.
out.
Yes. So blood thinners, ऐसे इतने लोग blood thinners खाते हैं, सबको blood नहीं आता ना.
Right.
So
right.
अगर blood आता है तो then there is something bigger.
Correct.
So people have to realize that blood in the urine means something has to be checked out.
So if the patient is complaining blood in the if the patient comes to you that doctor, I'm having blood in the urine, so what according to you the patient would be in which stage of kidney cancer?
स्टेज के किडनी
Bladder cancer.
स्टेज के पहले एक चीज बताना है कि क्या टेस्ट करना है.
Right.
से अगर ब्लड इन द यूरिन है, आप डॉक्टर को पहुंचते हैं कि कुछ पूछते हैं, डॉक्टर आपको टेस्ट करेगा, बट प्लीज इंक्लूड 2 टेस्ट इन दैट. कई बार पेशेंट क्या करते हैं, जस्ट दे विल गो टू द जनरल प्रैक्टिशनर. The general practitioner usually do a ultrasound scan, some urine culture, but that is not sufficient. So any blood in the urine should have 2 important tests. Once again, viewer can note that one test is called a cystoscopy, a camera test inside the bladder. The other test is called a CT scan.
Okay.
These 2 tests are mandatory for anybody who notices blood in the urine.
Right.
So if I do these 2 tests, I have 10 patients. ऐसे मैंने जो बता दिया, 10 में 4 लोगों का कुछ प्रॉब्लम है. वो 4 लोगों को क्या क्या हो सकता है, यूरिन में पत्थर हो सकता है, यूरिन का इन्फेक्शन हो सकता है, या कैंसर हो सकता है. ठीक है. सो इसलिए वी आर वेरी इंटरेस्टेड इन दैट 4, नॉट द 6.
Yes.
So it is duty mandatory for the doctor and the patient to go through these 2 tests and come to a diagnosis, or to say that हाँ मैंने कर दिया, कुछ नहीं है, मैं ठीक ठाक हूँ.
Yes.
That they have to do.
Okay.
Okay. So the major symptom for bladder cancer is usually blood in the urine.
Okay.
And blood in the urine का मतलब ये नहीं है कि advanced cancer है.
Okay, that's what.
इसमें
Yeah.
we have to tell a word or two about bladder cancer as well.
Yes.
Bladder cancer, मैंने बोला कि in a impact causes lot more impact to the patient. But अच्छी बात ये है कि majority bladder cancers early stage पे है.
Okay. If
So
they're showing signs.
if they are having even blood in the urine, doesn't mean they have advanced cancers.
Okay.
They may be in early stage. Just one treatment called TURBT, which is a camera test. हम एक कैमरा लगा के वो ट्यूमर को निकालते हैं, वो कई बार काफ़ी है.
Enough for say.
In the majority, almost 7 in 10, अगर मेरे पास 10 पेशेंट हैं, 7 पेशेंट्स को ये जो एक सिंगल प्रोसीजर is sufficient for curing them.
Maybe that's also because the tumor is not very aggressive.
Exactly.
Okay. So it doesn't spread.
Doesn't spread quickly. Early stage पे इसलिए patient cure हो जाता है. See, now you see why I took uro-oncology.
Yes.
Majority patients are cured.
Job satisfaction.
Job satisfaction.
That's
you
right.
treat these patients,
Yeah,
you
and you
feel happy about them.
yeah, that's right.
Yeah.
That's correct.
Then वो जो बाकी 3 पेशेंट्स को क्या कर सकते हैं, वो जो एडवांस कैंसर होते हैं उनको क्या करें. सो एडवांस कैंसर भी हो, once again चेतना, thanks to the scientific advancements इतना है कि we are now able to treat these patients so well that even in those 3 the majority gets cured.
Wow. So what's the treatment process?
So लेकिन ट्रीटमेंट इनको थोड़ा सा लंबा है कि इनको कीमोथेरेपी का ज़रूरत पड़ सकता है, रेडियोथेरेपी का ज़रूरत पड़ सकता है, कि मेजर ऑपरेशन का ज़रूरत पड़ सकता है, कुछ ना कुछ पड़ सकता है. लेकिन अच्छी बात यह है कि even in the 3 out of 10, majority will be cured.
That's nice.
Okay. So once again, just a quick summary and take home message to the viewers. Blood in the urine is an important thing. Don't ignore. If you find blood in the urine, men or women, smoking or non-smoking, go and get tested. Testing में पक्का एक CT स्कैन और कैमरा टेस्ट इंक्लूड कर लीजिए. अगर आपको ब्लैडर का कैंसर भी हो, इतना घबराने का ज़रूरत नहीं है. इलाज बहुत अच्छे इलाज है, मेजॉरिटी अर्ली कैंसर्स पे है, और जो एडवांस कैंसर्स भी हो, थोड़ा सा लंबा इलाज का ज़रूरत है, वो भी क्यूर होने का मौका बहुत अच्छा है. That's a simple take home message.
there is this misconception about cancer that many people have कि cancer है, it will definitely relapse. So, what are the chances of urological cancers being relapsed?
That in a way, that perception is wrong, Chetna.
That's what.
Yeah, and I'm very happy you raised this point because we can clarify that perception here to the
Yeah, because the
viewers.
patient feels that ये फिर से हो जाएगा मुझे,
Yeah.
and they are living in
That
that
eternal
fear
fear.
only. Yes,
Eternal fear,
exactly.
which is very sad.
Yeah.
So cancer is like the most important thing about any cancer, Chetna, is the what we call grade of the cancer.
Right, that's true.
So, and the good news in humanity is that the majority cancers are low to intermediate grade. They don't relapse, or they relapse very, very rarely. So, low grade, intermediate grade cancers भी कहीं भी हो, prostate में हो, bladder में हो, kidney में हो, the majority are cured. Cured मतलब they don't come back again. लेकिन हम क्या कहते हैं, वो पेशेंट्स को भी हम फॉलोअप पे रखते हैं.
Yeah.
See, any patient who had a cancer diagnosis, we don't say go away, it's fine. We always tell 6 महीने के बाद आइए, 1 साल के बाद आइए. We want to make sure that they are not, anything is not missed for them.
Right.
But that doesn't mean that they have to live in eternal fear about cancer.
That's true.
So they have to understand that low grade, intermediate grade cancer, the vast majority, you're talking about 90+% of patients being cured. So we have to be having that positive attitude where we believe that we are in the 90.
Yes.
Not in the 10.
Yes.
That positive attitude is the most important driver.
That's true.
For good life, good quality of life,
Yes.
and longevity.
That's true.
So I really do believe that as viewers, whoever is seeing this program should believe that they are fine.
100%.
लेकिन फाइन के मतलब ये नहीं कि डॉक्टर के पास नहीं जाओगे. फाइन का मतलब ये है कि that belief system that I'm fine, my life doesn't stop here.
That's right. That's right. And you are as normal as other people
Yes.
who didn't get cancer. So you don't need to always just think, I'm sick.
Yes.
Okay.
And cancer के वजह से you don't stop your life. Life is just now open. In fact, कई बार क्या होता है, these patients are much more carefully followed up
And then, yeah.
than the patient who's walking on the street who has not gone to the doctor for the last 10 years.
Yeah.
So जो patient को cancer diagnosis हो गया, they are always constantly under the follow-up of the doctor.
Yeah.
So in fact, they have a better life.
Blessing in disguise.
In a disguise, yes.
That's right. Okay, so now let's go to an important cancer, which is prostate cancer. So I think you're the one who can really give information about it.
Prostate cancer. So Chaitra will discuss both about cancer of the prostate and the non-cancer aspects as well. We discussed that. The reason why I said that is that they are all intermingled. So हमने discuss करने के समय ये दोनों को discuss करके जाना है so that viewers get that clarity.
Okay, मतलब the symptoms are more or less
Symptoms
same.
are same.
Okay.
Symptoms are same. So prostate का मतलब क्या है? What is prostate? So prostate is an organ which is specially men organ. Like uterus is a women organ, prostate is a men organ. It is located inside the tummy. That is the last organ in the body. उसके बाद the urine pipe starts off from the bladder, goes through the prostate and comes out to the body. This prostate जो है, it is very important for the young men because the sperms get mature in the prostate and therefore it is an important organ for the man to father children. But as we grow old, the value नहीं है, but gland तो अंदर ही है.
Right.
So prostate is also a hormone dependent gland like breast, like uterus, and these are something which because of the hormones in the body they change their structure.
Okay.
So as men grow older, the prostate भी थोड़ा बढ़ जाता है. बढ़ने के वजह से प्रॉब्लम है नहीं है, कोई फर्क नहीं है, लेकिन प्रोस्टेट टाइट हो जाता है. सो मेन एज वी ग्रो ओल्डर, आपने देखा होगा कि आपका घर का कोई एल्डरली मेन लाइक 50-60 ईयर ओल्ड आपका ग्रैंडपा, यू विल सी रात में 3-4 बार उठते हैं, बाथरूम जाते हैं. दैट्स ऑल वेरी क्लासिकल. लोग डिस्कस करते हैं उसको प्रोस्टेटिक सिम्टम. We call it, in our terminology, we call urinary symptoms. बट प्राइमरली क्या होता है कि प्रोस्टेट टाइट होने की वजह से यूरिन का फ्लो अच्छा नहीं है, इसलिए वो बार बार यूरिन जाने का जरूरत है।
And that is the majority of the times they fall.
हाँ, सो वो क्या होगा, वो रात में उठते हैं,
Yes.
गिर जाते हैं।
Yes.
Yeah.
Yeah.
So the fall is related to the fact that they have to get up 3-4 times to pass
Yes.
urine. So you are right, Chetna. As all the men grow older, they will develop prostatic symptoms. There is no exception to it. Everybody will have it. Some of them will be very bad, that they need help. Most of them will have borderline symptoms. They will go on adjusting themselves. And in a very tiny minority, they'll have cancers. Okay?
So, any reasons for this?
You have to be a man. You need to have a prostate. That's
No,
all.
why the
And you have
tiny
to age.
major? No, why the tiny majority is only getting cancer?
पता नहीं है ना. We do not know.
Okay.
There also we know very well that smoking and prostatic cancer has some correlation.
And genetics.
In genetics, अच्छी बात यह है कि genetic based prostate cancers are very small
Okay.
in number.
Okay.
Like breast cancer, genetic based breast cancers are very small in number. लेकिन इतना तो हमें पता है कि प्रोस्टेट होना चाहिए, बूढ़ा होना चाहिए और बढ़ना चाहिए, तो कैंसर होने का मौका है बस।
Okay, so in such patients, what are the treatment options available? And
हाँ,
before that, what is this classic symptom? Like you said that non-cancerous and cancer patients both have same symptoms. So how will they understand?
ओके, सो हमने क्या करेंगे, पहले सिम्टम्स को डिस्कस करेंगे सो दैट व्यूअर्स अंडरस्टैंड दैट। आफ्टर दैट हमने बिनाइन नॉन कैंसरस प्रोस्टेट के लिए कुछ इलाज क्या है, कैसे इलाज कर सकते हैं, दैट विल टच अपॉन।
Okay.
And after that, we will go into the cancer related discussion. Is that okay?
Yes.
Yeah. So symptoms क्या है? Like other cancers in the body, very early prostate cancer may not have symptoms. Like हमने कुछ चेकअप के लिए गए थे, डॉक्टर ने चेकअप किया, उसमें एक ब्लड टेस्ट है, PSA नाम पे एक ब्लड टेस्ट है, वो किया था, वो थोड़ा ज़्यादा था, इसलिए वहाँ से कैंसर डायग्नोसिस हो गया। That happens in at least a good number of patients even today in India. This is the commonest thing in US
Okay.
because there what we call awareness is more. And because awareness is more, people test voluntarily and find the cancer as well. India में इतना awareness नहीं है,
नहीं है, yeah.
आजकल awareness ज़्यादा हो रहा है, इसलिए above 50 men are asking for the test.
I know.
Yeah, before that it was not there.
Yeah.
नेक्स्ट इज सिम्टम, क्या सिम्टम्स होते हैं? सो सिम्टम्स को हम वी कैन डिवाइड देम इनटू थोड़ा सा एक क्लासिफिकेशन जैसे कर सकते हैं। गेटिंग अप ऑफन इन द नाइट, गोइंग टू रेस्ट रूम ऑफन, पासिंग यूरिन वेरी स्लोली, और उसके बाद एक सेटिस्फैक्शन नहीं है कि खाली हुआ है,
Okay.
कि कुछ रह जाता है, देन दे विल से कि आसपास ही गिर जाता है, दे विल से कि अर्जेंट जाना पड़ता है, कि जाने के पहले निकल जाता है। These sort of symptoms men will report. Not everybody will have everything, but they will have a concoction of many of these things.
Okay.
So इसी तरफ symptoms हो, then you go to the doctor. डॉक्टर आपको एक चेकअप करेगा, उसके बाद कई बार एक ब्लड टेस्ट करेगा, कुछ समय उन्होंने एक यूरिन का स्पीड का टेस्ट और एक अल्ट्रासाउंड करते हैं। देन दे विल कम टू अ कंक्लूजन कि हाँ भाई ये कैंसर नहीं है, सिर्फ एज के हिसाब से प्रोस्टेट का प्रॉब्लम, and then they will start them on some treatment called tablets.
Okay.
The tablet is called tamsulosin. There are now newer tablets called silodosin and alfuzosin. So long and short of it, one tablet a day.
Okay.
अच्छी बात यह है कि majority patients are better with this tablet.
That's good. That's
Yeah.
good.
और ये भी अच्छी बात है कि majority patient don't need an operation. See, this common perception, people come and ask me, सर मुझे prostate है, मैं बोलूँगा कि भैया आपको prostate होगा, यू आर अ मैन, यू विल हैव prostate. हाँ सर मेरा डॉक्टर ने बता दिया आपको ऑपरेशन करना है, मैं बोलूँगा सर कहीं it's not the case that everybody needs an operation.
Right.
Everybody will have a prostate. Some of them will require tablets. Only small number of them will require operation.
Okay. Okay.
So majority patients are treated only with tablets, and that probably is enough for the lifetime.
Okay.
Okay. And then tablets को side effects होता है, इतना ज़्यादा नहीं है, सो सम पेशेंट्स को क्या होता है, प्रोस्टेट का प्रॉब्लम की वजह से यूरिनरी ब्लैडर ओवर एक्टिव बन जाता है.
Yes.
इट्स कॉल्ड OAB एज
Yes.
वेल.
Yes.
सो प्रोस्टेट का दवाई भी देना है, OAB का दवाई भी देना है, बट कई बार एक कॉम्बिनेशन के टैबलेट की वजह से दे आर फाइन.
Okay. Okay. And maybe there are some non-medical management as well.
नॉन मेडिकल मैनेजमेंट वेरी इंपॉर्टेंट. रात में 7-8 बजे के बाद पानी कमती पीना.
Hmm.
And always have your room, especially the pathway to the bathroom, well lit.
Hmm.
कि गिरना नहीं है.
Yes.
और वो pathway में कोई स्टूल नहीं होना चाहिए,
No
कुत्ता
toys.
नहीं होना चाहिए.
No
You know,
कुत्ते
घर
के
में कुत्ते हो गए,
toys.
कुत्ता रहेगा. So this person, in order to avoid the dog, they will fall on that
Yes.
side.
Yes.
So these are small important things that any elderly patient can do. And in the bathroom, they should have a railing
Railing.
so
Yes,
that they
very
can hold
important.
the railing to pass
Yes.
urine
Yes.
or sit as well.
Yes.
So these are small changes they can do to make sure they're safe and well.
Okay. Okay. Like, what about pelvic floor muscle exercises?
Pelvic floor muscle exercises are extremely important for prostatic symptoms
Hmm.
as well as for OAB.
Oh, yes.
They really help.
Okay.
And therefore that is also part and parcel of this. The other thing commonly I would tell patients is to avoid caffeinated drinks in the night.
Yes.
For example, if you're at in the younger age, people have used to have a tea before going to bed.
Yes.
But जब अपने बूढ़ा हो जाते हैं वो सब काटना पड़ता है. You should
That's why,
stop
you
it.
know, our grandparents keep telling us कि रात को ये मत पी, रात को वो मत कर.
Yes.
This is the main reason because they
Yes.
know कि क्या होता है बाद में.
Yeah. So having the right lifestyle early on in the life will mean that later on the life you can be much more better. You don't struggle.
Yes.
So आजकल मैंने देख लिया कि very young patients, a lot of them have very heavy meals and caffeinated drink at 8 o'clock in the night,
Hmm.
especially after the Swiggy generation. They order food in the night and
Yes.
eat in the night as well. So it can become unhealthy. And this habit can become very troublesome as you grow older.
Right, right.
Because you're young, you're able to manage, but as you grow older, it becomes troublesome. So it is something that you need to be aware of.
True. So this was about non-surgical bladder prostate problem.
Prostate problem.
Okay.
Then वो benign, what we call non-cancer के लिए surgery भी है.
Okay.
So मैंने जो बताया था, so once again just to put in a context, अगर मेरे पास 100 what I have 100 men, about roughly 40-50 will not require any treatment. Another 30 or so will require tablets, and 20 patients will fail the tablets and require surgery.
Okay.
So surgery के लिए क्या करते हैं? Prostate is blocking the flow. We primarily unblock the prostate.
Okay.
So that they can pass urine better. उसके लिए कई तरीका है कि TURP नाम पे एक ऑपरेशन है, लेजर में एक ऑपरेशन है, यूरोलिफ्ट नाम पे एक ऑपरेशन, बहुत कुछ है. But the concept is the same. The concept is that prostate which is blocking the flow is unblocked so that the flow happens better.
Okay. Okay.
So how to deliver that will be you and your doctor has to discuss. Your comfort, doctor का comfort, prostate का size, बहुत कुछ factors है. But that is a discussion that you need to have in private with your doctor. कि
Okay.
क्या what operation will fit you best.
So in such cases, I mean, where there is no prostate cancer, there is no need to remove the prostate.
और पूरा prostate निकालने का जरूरत नहीं है. What we do is only create a pathway.
Okay.
Even in the non-cancer patients, sometimes we do something called simple prostate. जैसे किसी को 200 ग्राम या 300 ग्राम का बड़ा prostate है. We do an operation whereby we remove about 98% of the prostate.
Okay.
It's a very special operation, but that is a very rare thing.
Mm-hmm.
Majority patients, as viewers, the majority have to understand the vast majority of the patient doesn't require such complex operation. They just need a simple intervention called TURP or laser, which will do the job for them.
Okay, okay. Now, but then if such symptoms, if the person comes with such symptoms, how will you know that the person is having a prostate cancer?
हाँ, ये सही बात. So anybody who comes with symptoms, we do the testing. ठीक है? And the सबसे important test ये है कि there are two things. One, a clinical examination by a doctor. Doctor physically examine करना है. Second, they will do a blood test called PSA, prostate specific antigen. These two tests will tell the patient whether there is a possibility of a cancer or not. Once they have the possibility of a cancer, then they go on to other steps, which will be an MRI scan, a PET scan, and a biopsy. This will confirm or say that either you have a cancer or you don't have a cancer.
Okay.
So that patient who then comes to have a cancer will now have a PSA test, an MRI test, and a PET scan test कि to quantify कि क्या कैंसर है, कितना है, क्या ग्रेड है, is it localized prostate में या कहीं बाहर भी चला गया. All these questions will be answered in those tests.
Okay. Okay.
So depending upon what we call grade of the cancer, stage of the cancer, and the extent of the cancer, a plan is made. What we call treatment plan is made for the patient.
Okay.
So, and that treatment plan is usually made with a team of doctors. We call tumor board.
Okay.
So a set of doctors discuss these patients and say, a patient age है, इतना spread है, इतना spread नहीं है. This will be the right pathway for them.
Okay. All right.
And we give that advice to the patient.
So, what is the problem I see here is that how hesitant are these patients to go through this process?
Once you tell the diagnosis of cancer, patient becomes very scared. Yeah. So, and there is one other thing commonly, a common culture in Indian population. हाँ मेरा पापा को मत बताइए ना प्लीज. हाँ मेरा मम्मी को मत बताइए ना प्लीज. हाँ मैं आई आस्क अ क्वेश्चन. ठीक है, किसको इलाज करूँ, आपको या मम्मी को, आपको या पापा को? Because that papa has to go through the treatment. Do you think that papa who is 65, a man who has seen the world, will not figure out कि मुझे कुछ गलती है,
Right. I
ये
know.
बच्चे सब लोग कुछ कर रहे हैं,
Hmm.
something is happening,
Hmm.
they are hiding something
Hmm.
from me. So whilst you are very worried about your papa and mama, please understand they are much more experienced than you. They have seen the world much more than you, and they can handle the world much better than you.
That's true.
And what I tell and what I do is being honest. I just simply make the patient understand. I spend a new cancer diagnosis, Chetana, takes 40 minutes or 1 hour of consulting time. You have to make the patient understand every bit of the cancer. कि आपको भैया ये है, ये इतना तक है, ये स्प्रेड होने का मौका है, हो गया, एंड इसका इतना इलाज है, ये इलाज में ये अच्छा है, ये बुरा है, इसको ये बुरा भी हो, इसको कैसे ओवरकम कर सकते हैं. Such a long counseling process is required. And many a times you need at least 1 or 2 or even 3 sessions of counseling to come to a conclusion. And after that, then we pay to take, it's like cancer diagnosis and treatment is like a marathon. The patient is the runner, I'm the coach. I have to literally run with them. So we take at each point of time, they will get a bit depressed. We will coax them. We have a team called psycho-oncologists. We help them to, come back to their normal self.
That's right.
And once you explain to them, once you make them understand, and once you are very honest, 100% patient will complain. I have not seen even one patient who say that डॉक्टर आपने सच ही बता दिया, मुझे इसके ऊपर कुछ नहीं चाहिए. All patients after 1 or 2 days will come up and say, हाँ डॉक्टर साहब मैंने 2 दिन डिप्रेस थे, but I'm all right now.
Yeah,
I'm
that's
very
so
happy
good.
to take care of myself. अब बताइए मैं क्या करूँ.
Right.
That is the spirit that patients exhibit. So we should never underestimate. And a patient who comes with that spirit will always do well. They
That's
have
true.
that positive attitude कि मैं ठीक हो जाऊंगा.
That's why the counseling is very important.
Very important.
And you need to, whatever the patient is asking, even the silliest of doubt needs to be cleared by the doctor.
Yes. We give information sheet. We give printed sheets to make them understand. They can go and sit and read those sheets. We give them material to read. So patients will understand that.
Right.
And don't, please never say, हाँ मेरा पापा पढ़ा लिखा नहीं है.
Yeah.
They all understand very clearly. पढ़ा लिखा हो और ना हो कोई फर्क नहीं है. You just have to be honest. You tell them, make them understand. Don't make them emotional. Respect their views.
Right.
पेशेंट का व्यू क्या है, सर आपको क्या चाहिए. You lay these facts to them, they will always be happy to oblige you and go with you in the journey.
Okay. So all these patients who are diagnosed with prostate cancer needs prostate removal.
हाँ नहीं चेतना. So grade stage के हिसाब से है. So some patients will have very advanced cancer spread ho chuka hai. That patient will require chemotherapy, sometimes radiotherapy, sometimes called hormone therapy. So those are very deep discussion which we have with the patients and make them understand. But जो patients को spread नहीं हुआ है, then those patients को हमें prostate को निकाल सकते हैं with an operation called radical prostatectomy, or we can give radiation to the prostate. दोनों का कुछ अच्छा बुरा बात है. That detailed discussion you should have with the patient, make them understand कि अच्छा क्या है, बुरा क्या है, and then patient will take an informed decision. We call this informed decision. So patient will understand what, okay, मैं ये करने के वजह से मुझे ये अच्छा हो जाएगा और ये कुछ चीज एक का side effect है, and for that side effect what should I do?
Right.
That make the patient understand that they will come with your journey. So we put all these options to the patient and they inform us as what their options are. They want to do surgery, we'll do surgery to remove the prostate. If they want radiation, we give radiation to the
Right.
prostate.
Right. So that's a sign of a good doctor, actually, you know.
That's वही करना है.
That's
the
nice.
right thing to do, because in this we are treating the human being.
Right.
The human cancer is something that the human being has and we need to cure. But the human being is more important.
That's
That
nice.
man in front of you is more important.
That's nice. And then talking more about how robotic surgery is doing so well in prostate cancer treatment.
Chetna, if you ask me what has happened, the biggest leap in mankind in the last 20-25 years, it is robotics. Yeah. Gone are those days when, bade operation, kata puta, pura, wo sab, we have reduced it. At least vast majority we have cut down.
Yes.
So big operations are done even today. Even today, I do every month at least 3-4 big operations I do. But the majority of the patients we have moved to robotics. उसमें क्या है, we give the joy of minimally invasive surgery 4-5 छेदा के साथ, but the recovery which is like fast. मान लो एक prostate का कैंसर का पेशेंट, we have come to a point where हमें पेशेंट को सुबह एडमिशन करते हैं, 6 बजे 7 बजे ऑपरेशन शुरुआत, 10 बजे खत्म, 2 बजे खाना खिलाएंगे, 4 बजे चलाएंगे फिर आएंगे, 8 बजे छुट्टी कर देंगे उनको.
That's so good.
That is the joy. Patient comes from their bed, goes to their bed and sleeps. That is joy of robotics.
That's nice. So how
Yeah.
since
How
how
it has
many years?
changed.
Yeah, and
It's
since how
changed.
many years have you been practicing robotics?
So robotics, since the last 12 years. Robotics got introduced in 2003-4, but robot started maturing a lot. Machine was in the early stage. 2008-9 it started becoming widely available. 2012 I started operating. Now I've crossed about 1000, nearly 1500 operations.
Wow.
So what has happened is that we not only did, we trained the next generation of doctors as well
Right.
to do these operations, and the robotic surgery as a penetration is now much better. And पहले ये तो हुआ था, prostate was the biggest thing in robotics. Nowadays we do everything, almost everything with robot. किडनी का ऑपरेशन रोबोटिक में होता है, ब्लैडर का ऑपरेशन रोबोटिक में होता है, पिनाइल कैंसर का ऑपरेशन रोबोटिक में हो सकता है, फिर उसके बाद क्या जनरल सर्जरी में गॉल ब्लैडर वगैरह हर्निया रोबोटिक्स में होता है. Almost everything is robotics.
The organ is completely preserved that way.
दो चीज, patient is well preserved.
Yes, that's the right word.
Secondly, you give excellent functional outcomes कि function में जो है वो preserve होता है. And thirdly, recovery. Patient, मतलब the shortest form of recovery is available to the patient.
Right.
They are not bogged down by 3 months, 4 months घर में पड़े रहो.
Yes.
जैसे imagine a 45-year-old, a working man or a working woman.
Yes.
They have a problem. They
Yes.
come get treated. 15 days they've
Right.
gone back to the work.
Yes.
Yes, that is, the productivity is kept. The human being mentally is good. They are going back to the normal life. So that is a great thing, isn't it?
That's right. So lastly, any important message on lifestyle modification that our viewers can follow to maintain a good urological health?
Quite a few, Chetan. Thanks for the question. The first thing I want to say, no smoking.
Yes.
Probably I tell
Absolutely
this
no.
in every meeting, every show. I do not know. People listen to my show. It's probably one theme I've repeated thousands of times. And I will not stop till I exist. The second thing I would say is drink adequate water. There are people who drink 6-7 liters. That's too much. There are people who drink 1 liter. That is also very less. As long as your kidneys are working well, you need 2 to 3 liters of water a day. So maintain that hygiene. Thirdly, do an annual checkup. It is a very good thing. Anybody above 40, in my opinion, should mandatorily do an annual checkup. आपके घर के पास का डॉक्टर,
Yes.
ये बड़े बड़े हॉस्पिटल जाने का जरूरत नहीं, जस्ट घर के पास का डॉक्टर, फुल बॉडी चेकअप, डायबिटीज, हाइपरटेंशन, अल्ट्रासाउंड स्कैन, ब्लड टेस्ट, एक्सरे, जस्ट आधा दिन का काम. Please do it. The fourth thing I would say is, do not panic. A diagnosis of cancer is not the end of life.
Yes.
It is a new journey.
Yes.
And the good news is that majority cancers are curable. We always have to have that positive attitude to say that I will be that majority. I will win over.
Yes.
I want lot more cancer, not warriors. I want people who are cancer conquerors.
Yes, that's
Who are
true.
cancer conquerors. So that is the aim as a doctor for me. And that's what I want to tell the patients as well.
So we'll do a small and interesting segment, that is rapid fire segment.
Okay.
So here I'll ask you a few questions and you have to be very spontaneous in your answers, all right?
Okay.
So
I'll do my best.
you'll do it, I know. So my first question is, what is the most common sorry, I'll do it again. What is the most common non-cancerous condition affecting the prostate?
Benign prostatic enlargement. It's called BPH in a very common man's term. It's primarily prostate getting a bit swollen and, more important, tighter, so that the urine is not flowing well.
All right. Second one is a true or false question. Drinking plenty of water can help prevent urinary problems related to the prostate.
Partly true, partly false. True ऐसा है कि drinking plenty of water, as in maintaining adequate water intake, will prevent infection, prostatic infection, etc. etc. But जो benign enlargement of the prostate जो होते हैं, that is not stopped by drinking water.
Okay.
So आपने जो बताए थे उसमें आधा सच है, आधा it's not.
Okay. Next one is, which age group is the most commonly affected by
BPH.
Yeah, I wanted to say the whole thing.
Benign prostatic hyperplasia.
So I'll do the question
Yeah,
again.
repeat कर लीजिए.
Which age group is most commonly affected by benign prostatic hyperplasia?
Usually age between 60 and 70 or 60 plus.
Okay. What's one food item men should reduce to maintain prostate health?
Red meat consumption.
Okay.
Too much of red meat consumption can cause enlargement and has a tiny risk of cancer as well. So red meat consumption should be limited.
Again,
And we also say barbecued food, but India में इतना barbecue नहीं होता.
Right. Again, a true or false question. Regular pelvic floor exercises can improve prostate health.
Regular pelvic floor exercises improves the prostatic symptom.
Okay.
मतलब अगर आपको यूरिनरी सिम्टम हो, वो pelvic floor exercises के वजह से वो सिम्टम कमती हो जाता है.
So it can be like a maintenance
It's
program.
a maintenance. It will help the patient with the symptoms.
Okay. One symptom of BPH that men should never ignore.
Blood in the urine.
Okay. Can stress impact urinary or prostate health? Yes or no?
Stress impact prostatic symptoms. जैसे stress के वजह से people will feel that they have to go pass urine often.
Okay.
So yes, it can cause an impact on the symptoms.
Again, a true or false question. All prostate issues require surgery.
No, not at all. Majority
false.
requires only tablet.
All right. What simple daily habit men can adopt to lower prostate related health risk?
Drink adequate water, not over drink the water, and consider a checkup at least once in a year after the age of 60.
All right. So thank you so much for giving your time.
Thank you so much.
That's it for today's dive in urological health. Remember, whether it's managing common conditions like overactive bladder or BPH to preventing serious illness like prostate cancer, awareness and proactive steps are the keys to healthier life. So if you find our videos informative, don't forget to subscribe to our channel and follow us on Instagram at Mankind Specialities for more such valuable health discussions on various health topics. Until then, stay informed, stay healthy.